If you're suffering from a rectal prolapse, you'll know how uncomfortable and distressing this condition can be. Now, fortunately, there are a number of things you can do at home to manage your prolapse and reduce the risk of your prolapse worsening. Hi, I'm Michelle, and today I'm going to be guiding you through how to manage your rectal prolapse better at home. So we're going to be talking specifically about bowel movements and how you can manage those to improve your rectal prolapse or prevent it from getting worse, and also too specifically going through some exercises for rectal prolapse that you can do. And these are exercises for mild to moderate prolapse, or if you've had prolapse surgery in the past. So let's get started on rectal prolapse. So rectal prolapse is a condition where the rectum descends out through the anus, and you can see it in this illustration here. Now, if you've got a mild rectal prolapse, it just means the mucosa or the inner lining is coming down. And if you've got that condition can be particularly responsive to some of the physiotherapy techniques I'm about to go through today. Let's start with our bowel emptying and our bowel movements. Now, you can see here is a Bristol stool scale. On the Bristol stool scale here, you can see number 1 is lumps, hard lumpy stool, and down to 7 where it's much looser and a watery stool. Now, both those types of stool can be challenging when you've got a rectal prolapse. Ideally, you'd want your stool consistency to be about a type 3 to 4. Now, if it's hard and lumpy, like the type 1, it means you're more likely to strain to empty, and you don't want to strain to empty with a rectal prolapse because that can obviously make the condition worse. There's a number of things you can do to modify your stool consistency. And the first thing is to take a laxative like an osmotic laxative. Now, these are laxatives that actually just soften the stool and gently make them move through the bowel. They don't give you an aggressive bowel movement. Now, I've got one here called Movicol or Gavalax, and these are really nice gentle laxatives. They normally come in like a sachet, and you can often have up to 8 sachets a day, but just check with your pharmacist on that and make sure that that's appropriate medication for you. But that's a useful thing to know. The other thing you can do is actually incorporate stool softener foods into your diet so that your stool is soft and not hard, and you can refer to my stool softener foods video up here too for further information on that. You might also find that reducing the amount of fibre, high fibre, helps you a little bit. If your stool is really large with a lot of high fibre, it can make emptying difficult too, so especially if you're prone to constipation. So just monitor how much fibre that you're having in your diet as well. Now, conversely, if your stool is too soft, it can also make you strain to empty. So again, there's medications you can take, Imodiums or anti-diarrhea medications to firm the stool, and you can speak to your doctor about getting that medication. But also too, you can try a product like psyllium. So psyllium or psyllium husks, you can buy those in most stores now, or in your health food shop. It's just a grain, and it actually swells and it sops up some of the looseness of the stool, so it'll make the stool firmer. So that's something you can also do. Another handy tip for if you've got loose stools and you're having problems with rectal prolapse is to use moist towelette as your last wipe. So I've brought some of those along too, just making sure that they are alcohol free. So these sort of wet wipes are great to use, but don't use the alcohol ones because they can really affect around the back passage. Make sure you use the alcohol-free ones. And the other thing that's also useful to know to help with the loose stool is to use a barrier cream. So this is a barrier cream. They can often be used for things like nappy rash. You can just get those from the pharmacy as well. But that can also help around the anus as well if you're suffering from some leakage. So let's now move on and talk about the position and technique so that you're not straining through your bowel to empty. All right, the first thing is to get your position right. So you're going to go with the urge, obviously. When you feel the urge to go, don't go without the urge. So what I want you to do is practice, and you can practice along with me if you like at home. We're going to practice emptying our bowels without straining. So what you do is you sit on the toilet with your legs apart, and you rest your body forward with your hands or your elbows, forearms on your thighs if you need to. I find it much more comfortable to have my hands in that position, inward curve in the lower back. Now, in that position, that's the ideal position for emptying. What you then do is you brace and bulge. Now, the brace and bulge technique means you're going to make your waist wide and bulge your tummy forward to empty. If you pull your tummy inwards it contracts your anal sphincter, and you're going to have to push down hard to actually empty. If you can bulge your tummy forward in the way I'm about to teach you, it opens up your anal sphincter. So this is what you do. Pushing power comes from your waist, and if you say it makes your waist go wide and you'll feel the sides come out. That's where your pushing power comes from. Don't push down through your bottom because that's going to push the prolapse down and out. Try and pushing it through that closed anal sphincter. So and then oo, so moo, you can think moo to poo, moo, bulge the lower tummy forward at the same time. So you've got your pushing power come from here, oo at the bottom, and then if you need to push further, make your waist wide again, and then you've finished. Okay, that's how you empty, as opposed to pulling in, straining and pushing down, which is a common pattern. I didn't mention too there, before you start, and I should have mentioned this, try to have a few relaxed breaths, because often just breathing allows the stool and allows your pelvic floor to relax, and you find that you start to empty even just with the relaxed breaths. So that's your patterning for your bowel movement. At the end of that, try to lift and squeeze through the anus, through the rectum, drawing up, and we'll talk about these exercises just now in a moment, to reposition the prolapse back inside the body if you're able to. And I also talked about making your wipe a last wipe, wet wipe, so you could also use the wet wipes that I just talked about to clean if you're having problems with the cleaning. All right, now let's move on to exercises. Rectal prolapse exercises are essentially Kegel exercises or pelvic floor exercises. Now you can see these detailed in my exercise videos here or on my pelvic.app, free app that you can get. You can download and have all my videos in the same place. But if you'd like to check those videos there, you can actually go through this in detail. Otherwise, let's go through this now. With your rectal prolapse exercises, what you're going to do is you can either do them lying down, sitting or standing. Try to reduce your prolapse if you can. That means pushing it back inside. You want to keep it inside your body as much as you can, not outside, especially when you're doing your exercises. So you might find that doing your exercises first thing in the morning is a helpful way to manage this. You might find that also then doing your exercises lying down, or you can do them sitting, or you can do them standing. It's really your choice. If you're starting out, maybe start lying down. What you then do, and let's do these exercises together. I'd like you to sit nice and tall. If you're in a chair, move forward away from the back of the chair and keep your back arch inwards. And you're going to start around the back passage and you're going to squeeze around the sphincter as if you're stopping wind. So we're not squeezing our buttocks, we're just squeezing, and think about that sphincter and think about tightening if you can. Can you tighten that? And then release. I want you to tighten it again and now lift it inside as if someone's put a hot poker there and you're trying to lift away from it. Can you do that? And relax down. So you're doing both. You're doing the squeeze and the lift inside, and then you're doing the lower down. That's part one. The next part is to go right to the front passage. So if you're a man, you're thinking about, or man and woman, you're thinking about stopping the flow of urine, if you can, and down. But also too, if you're a man, I want you to think about shortening the penis, so retracting slightly, retracting inwards. Or if you're a woman, your front two openings, drawing them up, lifting and lowering down. So we're going to put that all together, both those actions, and you've got the exercise correct. You've got the back passage, so let's do that first, tighten and squeeze, then see if you can do the front passages as well, either retract or lift and squeeze inside. Keep breathing, keep holding, and relax down slowly and have a breath. Now those are your exercises. Ideally, you'd be trying to do those every day. You're doing that action after a bowel movement. If you reduce the prolapse, then try to actually do those exercises afterwards as well, just to increase the tone in the external anal sphincter, which is that bit that can tighten around the sphincter. And also too, I'll put the recommended daily guidelines for how many exercises to do, how long to hold in the notes below, so you can refer to those as well. So as you can see, there's quite a number of things you can do to manage a rectal prolapse. The first thing we talked about was managing your stool consistency. The second thing we talked about was managing your bowel movements with the correct technique and using the correct position. And finally, we talked about the importance of doing some rectal prolapse exercises so that you're making your pelvic floor muscles strong to support your rectum and to keep it in place. So I really hope this information helps you manage your rectal prolapse better. If you've got any questions or comments, please leave them below. And if this video has been helpful, I really appreciate it if you could give it a like below, because this helps other people with rectal prolapse find the video too. So thank you very much for watching today. I look forward to seeing you next time. Bye for now.